Yeah, where are you?
Where
Liberty University Nursing Lab.
Okay. Hi, I'm Rachel. I'm doing a sophomore checkoff for the neurologic system.
Hi, my name is Brian Bacallion. I'm a Liberty nursing student. May I have you state your date, birth, and location?
Yeah, Ruben Stoltzfus, January 16th, 1993, Liberty University Nursing Lab.
Okay, that's great. Well, I'm going to go ahead and get started on assessing for your neurological system. I'm going to assess you on a series of 5 tests for fine motor skills. First, I'm going to have you, I'd like you to go in a motion of moving your hands up, turn, down, up, turn, down, up, turn, down. Okay, that seems to be intact. Next, I want you to take your thumbs and your fingers out, bilaterally assessed, move back and forward by touching each and one of your index fingers. Okay, that's great. Testing now for the index finger. Follow my finger and touch it. Okay. Now I want you to touch your nose after you touch my finger. Okay, that's great. Now I want you to close your eyes and in an alternating fashion, touch your nose. Okay. Okay, that's great. All right, moving on to Pronator Drift. I want you to supinate your hands and close your eyes. Okay, as we noticed that the patient's negative for Pronator Drift since the hands and the arms haven't pronated. Moving on to lower extremity, fine motor skills. I want you to move the heel of your heel and move up and down from your shin. Okay. Seems to be intact, and this would be bilaterally assessed. Moving on to cerebellar function. First, I would have the patient assessed for Romberg sign. I want you to stand up, Mr. Stoltzfus. Close your eyes. I'm at the side. Give him a little push. A little bit of swing's common, and he's negative for Romberg since he has not completely lost his balance and equilibrium. Next, I want you to move towards the door. Okay, now I want you to heel-toe test. Okay, that's great. That was for heel-toe, and his cognitive function is working, whereas the gait was just walking towards the door, and his arms, his extremities seem to be alternating in a coordinated fashion. Moving on to testing the patient's sensory function. You can take a seat now. Primary superficial touch and pain, and point location, corticosensory is being assessed with a sharp dull test. Mr. Stoltzfus, I'm going to be pointing. This is sharp and this is dull. Patient will close his eyes, and I'll be touching up on all extremities. Now tell me whether it's sharp or dull.
That's sharp. It's on my right arm, and it's right there.
Okay, he's noted that.
It's dull, and it's on my left arm right there.
Okay.
Sharp on my right foot right there.
Okay, that's correct.
It's dull on my left foot right there.
Seems to be intact. And then moving on to testing the patient's position of motion testing. This is neutral, this is up, and this is down, okay? Okay, close your eyes.
Up. Down. Neutral.
Okay.
Up.
Okay, thumbs and the great toes were being assessed bilaterally. Moving on next to vibration. Okay, so I want you to tell me when you start feeling the vibration and when the vibration diminishes. This will be assessed on the patient's bony prominences. Ready?
Feel it. Stop.
Okay.
Feel it.
All right, stop. All right. Okay, this would be bilaterally assessed, and I would also assess it on the sternum as well.
I feel it. Stop.
Okay, stop. Seems to be intact. Now moving on to testing the patient's for cortical sensory. First starting with Graphesthesia. I'm going to, Mr. Stolfus, I'm going to write a letter in your hand, a number in your hand, and you're going to tell me.
0.
That's correct. This would be bilaterally assessed. And now for stereognosis, I'm going to write, I'm going to put a foreign object in your hand. And you're going to tell me what it is.
Alright, this is a paperclip.
Okay, that's great.
You're about halfway.
Okay. Tell me what's in this hand.
It's a paperclip.
Okay, that's great. Seems to be working. Now, assessing the patient for SGH. Extinction phenomenon. I'm going to touch you in two places at once, and you're going to tell me whether you feel one or two sensations, okay?
2. 2.
This is done in a simultaneous fashion as well. Okay, so now we're done with that, with cortical sensories. And now I'm going to be assessing you, Mr. Stolfus, for your reflexes. Assessing the patient for the bicep reflex. I'm going to strike the thumb. Insert my thumb in the cubitus. Okay. Next, give you a tricep reflex. Strike in between the bony prominences. Okay. All of these reflexes are bilaterally assessed. Now testing for your brachioradialis. 1/3 up medially from the pulse. 1/3. Okay. Supporting the forearm. Okay. The thumb is slightly pronated, which is good. And now assessing the patient's patellar reflex. I strike it in the dent right below, a ½ inch below the patella, to an inch. All right, you got a strong reflex. We could also do that, okay, by making the fist. If the patient was not having a hard time having a reflex, we would use an isometrics method by clenching the fingers together. And now assessing the patient for the Achilles. 90 degrees with the foot. We had a slight plantar reflex, and now for the foot, striking the lateral aspect of the foot from the heel across. This is bilaterally assessed, I must remind you. If there was flaring of the toes, this might suggest a tumor in the brain. But we have normal response of curling of the toes.
2 minutes.
Okay. Now assessing the patient's. Now we're done with reflexes. I'm going to go over the cranial nerves. Olfactory patency of nerves assessed by including one nose at a time. Optic for vision. CN2. We would use Rosenbaum chart near vision, 14 inches away. The Snellen far vision. 20 feet away, both graded the same. Peripheral vision, assessing the peripherals by using the bunny ears method. Then moving on to oculomotor, CN3, CN4, trochlear, CN6, abducens, all under eye movement. I had the patient perform corneal light reflex, convergence, and nystagmus, and then moving on to CN5 trigeminal. I would test the facial sensations of the face, the 6 areas, and the masseter muscle by clenching, protruding, and so on. CN7 facial. I would be testing the patients for smiling, frowning, different facial expressions. CN8 vestibulocochlear acoustic. Perform a variety test. For the whisper test, the Weber, and the Rhine test for bone and interconduction. CN9, glossopharyngeal, watch the patient talk, swallow, and rise and fall of the soft palate. CN10, vagus, For the gag reflex, CN11, spinal accessory, I would apply pressure to the shoulders while the patient applies resistance, shrugs up his shoulders, and CN12, glossopharyngeal, and the patient sticks his tongue out and moving in different movements. And that concludes the assessment.